Hello all, today we are going to discuss about care of death and dying. I am Mrs. Golden, working as tutor in M College of Nursing. So the objectives of this class are, at the end of the class we will be able to see about introduction to care of death and dying, the signs of dying, nursing care of dying patient, management of dying patient, what are the physiological changes that occur after death, and what are the clinical signs of clinical death, hygienic care of a dead body, nursing care of a dead body, and medical legal issues. Introduction. Care of a dying patient refers to the care in the last days or hours of life. So the goals of care during the last hours and days of life are to ensure comfort and dignity to a dying patient. Signs of dying are loss of appetite, decreased oral fluid intake and decreased thirst, increase in weakness or fatigue, and decreased blood perfusion, including decrease in the urine output, perfusion cyanosis, and cool extremities. Neurological dysfunction may occur, including delirium, lethargy, and coma, and there are changes in the respiratory patterns. Loss of ability to close eyes, noisy breathing as pharyngeal muscles relax. In particular, neurological dysfunction can sometimes result in terminal delirium, which include a mounting syndrome of confusion, hallucinations, delirium, myocardial jerks, and seizures prior to death. So the nursing care of a dying patient are create a peaceful environment according to the patient's liking. Prepare instructions about whom to call when death occurs. Give the relatives a time to witness what is happening around. Create and use all the rituals that can mark the occasion in a respectful way. When death occurs, families should encourage to take whatever time they need to feel what is happening and say their goodbyes to a dying patient. There is no need to rush the body to the funeral home, and some families want to stay with the body for a period of time after death occurs. Meeting the physical needs of a client. A patient in a terminal stages of death is given all the necessary care to ensure the comfort and freedom from pain. Physical comfort is as important as emotional and spiritual comfort. Meeting the nutritional needs of a patient. Patients suffer discomfort due to decreased gastrointestinal activity. Nutrients and fluids are given intravenously when they are not tolerated orally. Water is given as long as the swallowing reflex is present. When there is a problem, gauze soaked with water may be placed in the patient's mouth for him to suck and moisten the mouth. Meeting the special needs of a patient. Mucus that is collected in the throat is removed by placing the patient in a lateral position and wiping it away, or by doing a suctioning. Frequent oral hygiene is done to keep the mouth free of dried secretions and feeding fresh to the patient. Vaseline or cream is applied to the lips to keep them soft and moist. Nostrils are kept clean and lubricated as necessary. The eyes are cleaned with the cotton balls, moist and with normal saline. Lubricating drops or ointment may be applied to the eyes. The patient may perspire profusely even when the skin feels good. Bath the patient and change the linen when needed. Lightweight bed covering must be used. Heavy covering seems to be uncomfortable to a dying patient. Urinary and fecal incontinence may often occur due to the relaxing of the sphincter muscles. Pads are used to keep the bed linen from being soiled. The patient is checked frequently and the pads or linen is changed as necessary. Frequent change of a position is must. Pain is a great problem in some diseases. The doctor orders sufficient medication to control the pain. It must be given as frequently as per minute. If it does not control the pain, inform the doctor. Nursing measures for pain are used to make the patient comfortable. Dimness and shadows are confusing and increase the sense of loneliness. So we have to provide adequate light facility to the patient. Meeting the emotional needs of a dying patient. Touch is an important method of communication with the dying person. The patient appropriately holding his hand or laying a hand on an arm, his head or some other part of the body, which conveys a feeling of caring and concern. Speak in a normal voice to the patient or to the others in the presence. Do not speak in a whisper in the patient's presence. It is distressing to most sick people. Hearing is believed to the last sense to disappear. Weeping is disclosed in the patient's presence or nearby. Management of dying patient. Management of dying patient includes concern, which includes empathy, compassion, and involvement are essential. Competence, skill and knowledge that can be reassuring as warmth and concern. Communication. Allow the patient to speak their minds and get to know them. Children. If the children want to visit the dying, it is generally advisable they can bring consolation to the dying patient. Cohesion. Family cohesion reassures both the patient and the family. Cheerfulness. A gentle, appropriate sense of humor that can be palliative or a somber or anxious demeanor should be avoided. Consistency. Continued, persistent attention is highly valued by the patients who often fear that they are burdened and will be abandoned. Consistent physician involvement may mitigate the fears. Physiological changes that can occur after death are: first one is rigor mortis. Rigor mortis is the stiffening of the body that occurs about 2 to 4 hours after death occurs. Results from a lack of adenosine triphosphate, that is ATP, which causes the muscles to contract and in turn immobilize the joints. It starts as an involuntary muscles, then it progresses to the head, neck, trunk and extremities. The next one is algor mortis. It is a gradual decrease in a body temperature that occurs after death. When blood circulation terminates and hypothalamus ceases to function, body temperature may fall down. That is called as algor mortis. Next one is livor mortis. It is a discolorization of the body after death. After blood circulation has ceased, the RBC may broken down, leads to discolorization of the surrounding tissues. Decomposition. Tissues after death become soft and eventually it is liquefied by bacterial fermentation. The hotter the temperature, the more rapid the change. So bodies are stored in a cool places or embalming. Signs of clinical death. Signs of clinical death are absence of pulse, heartbeat and respiration. Red blood cells roll down to drop or forming relax in retinal vessels. Pupils are fixed and it is non-reactive to light. Absence of all the reflexes, rigor mortis, postmortem hypostasis and autolysis. Hygienic care of a dead body. Hygienic care of a dead body includes family members or close friends may choose to be involved in washing or dressing the body after death has occurred. Caring for a body is not easy and can stir up strong emotions. Washing the person's body after death is much like giving the person a bath during his or her illness. Wash a person's face gently by closing the eyes before beginning. Use the soft pad of your fingertips. If you close them and hold them closed for a few minutes following death, they may stay closed on their own. If they do not get closed again, place a soft smooth cloth over them. Then place a small soft weight to keep the eyes in position. To make a weight, fill a small plastic bag with a dry uncooked rice, lentils, small beans or seeds, and close the eyes and place a small weight. After you wash the face, close the mouth before the body starts to stiffen. If the mouth will not shut, place a rolled towel or washcloth under the chin. If it does not provide enough support to keep the mouth closed, use a lightweight, smooth fabric scarf. Place the middle of the scarf at the top of the head, wrapping each end around the side of the face, under the chin and up to the top of the head, where it can be gently tied. These supports will become unnecessary in few hours and it can be removed. Wash the hair unless it has been washed recently. For mine, you might shave the face. It would be the normal practice. Clean the teeth and the mouth. Do not remove the dentures because you may have difficulty in replacing them as the body stiffens. Clean the body using a face cloth with water and a small amount of soap. Begin with the arms and legs and then move to the front and back of the trunk. You may need someone to help to roll the person to each side to wash the back. If you wish, you can add a fragrant oil or flower petals to rinse the water. Dry the part of the body you are working on before moving to the another side. Some families or cultures may choose to apply a special lotion, oil or fragrance to the person's skin. Dress or cover the body according to the personal wishes or cultural practices. A shirt or a dress can be cut up in the middle of the back from the bottom to just below, but not through the neckline or collar. Place the arms into the sleeves first and then slipping the neck opening over the head, tucking the sides under the body on each side. Then position the arms alongside his or her body and be sure that the legs are straight. If a person is in a hospital bed, the head is raised and lower the head of the bed to the flat position. Nursing care of a dead body. It is the function of the physician to declare the death of the patient. Patients are not legally dead until the physician has certified death and nothing should be done that would interfere with life. The physician fills the death certificate before the body is taken to the home. Nurses should know whether there is an autopsy or an inquest and she should get a written permission for the autopsy. When the death occurs, follow the certain communicable diseases and special attention should be given to prevent it. Custom varies in relation to the care of the body after death. Bodies are embalmed or preserved to look as natural as possible. The eyes are closed immediately as in sleep and the body is straightened with the arms laid at the sides. Dentures are removed and replaced and the mouth is closed. The body should be handled with reverence. Remove all the appliances used for the care of the patient. Remove the ornaments of any type from the dead body. All the jewelries should be removed and entrusted to the closest relative and the receipt should be obtained for their delivery. Send the body as clean and neatly dressed as possible to a mortuary. Proper identification should be done as the patient's nurse, health name, age or address, ward number, bed number, date and time must be ensured. Patient's cause of death must be sent to record section for filing. After the dead body is removed from the room should be treated as in case of discharge of a patient. Medico-legal issues. A sudden death that occurs as a result of cardiac arrest and which requires CPR, that is a cardiopulmonary resuscitation, by competent persons. This is a life-saving measure according to the agency policy unless a primary physician has written a do not resuscitate order in the client's medical record. Wills of the patient. Various countries have laws regarding the legal requirements for written and oral wills. Nurses are usually required to notify the physician and nurse supervisor before acting as a witness and signing a will. Nurses should refrain from assisting the client with the wording of the will, as this should be done with legal advice from an advocate. Pronouncement of death. The government has formed laws to protect the public when dealing with the death. The various definitions of death are as follows: the absence of awareness of external stimuli, lack of movement or spontaneous breathing, absent reflexes, a flat brain wave or EEG, and brain requires irreversible cessation of all functioning of the brain. It is usually within the scope of practice of medicine in pronounce a client dead. care of deceased. When a client dies, and the nurse is responsible to treat the deceased with respect and dignity. The nurse should prepare the body for removal to the mortuary according to the agency policy. The nurse is responsible for properly identifying the body could result in severe distress for the family as well as legal for both hospital and the nurse. Thank you.